good afternoon, fellow Rotarians. Good afternoon sa lahat po ng mutag ngayon. Maraming salamat. And to start this meeting, may I call on our life-changing president, Madel Lai, to call to order.
Good afternoon, everyone. By the power vested in me by Rotary International as a life-changing president of RCMS Rotary Club of Manila Supreme 198, I hereby call these COVID-19 updates for Rotarians to order.
Clap, clap, clap.
So today, RC Manila Supreme 198 is dedicating this prayer to all COVID-19 patients who still battling in COVID-19, and also to our dearest LCP Jo Santiago of RC of Chinatown Circle.
I saw some dirty kids today begging on the street. Their daddies and their mommies didn't have enough to eat.
I heard about the fighting in a place that's far away, and all the lonely people who don't have a place to stay. It's sad that these things happen in a world that you've made, but I know for sure that there is hope, so now I will pray. Let there be peace and harmony in this world. Let there be love and joy for every boy and girl. Let your glory fall upon the earth, bring healing to us all. Oh Jesus, this I pray. Oh Jesus, this I pray. Oh Jesus, this I pray today.
I saw a sick old lady lying on a bed. She looked so weak and helpless that she had to be fed. I heard my neighbor crying when her daddy banged the door. Another little broken heart, I wonder, are there more?
It's sad that these things happen in a world that you've made,
But I know for sure that there is hope, so now I will pray. Let there be peace and harmony in this world. Let there be love and joy for every boy and girl. Let your glory fall upon the earth, bring healing to us all. Oh Jesus, this I pray. Oh Jesus, this I pray. Oh Jesus, this I pray today.
And now for the Philippine National Anthem.
I am a
Rotary flag as the flag of peace and world. I shall serve
para kung sakali. Ako na lang
community.
Depende, gusto pa ikaw mag-share.
Help achieve universal unity. To Rotary, I shall dedicate my all. World understanding shall be my cherished goal. With a four-way test, I'll pursue my quest, giving my little way help attain. Peace in the world, I shall not have lived in vain. I observe service above self, lend a hand to all who need my help. I'll give my spouse to involve in Rotary, and in Rotary race I will train my family. With a four-way test, we'll pursue our quest, giving our little way help attain. Peace in the world, we shall not have lived in vain. Build a bridge for tomorrow's youth, strengthened by nothing but the Let's join our hands, there's no reason we'll divide. We shall all understand why the good Lord is our guide. With a four-way test, we'll pursue our quest, giving our little way of the day. Peace in the world, we shall not have lived in vain. Peace be achieved, we shall not have
And now, for the Rotary Pledge, please repeat after me. I am a Rotarian.
I
I
am
will, I will always uphold the truth.
I will always uphold the truth.
I will always uphold the truth.
I am a Rotarian.
I am a
I am a
Rotarian.
Rotarian.
I will
I
always
am a
strive to be
Rotarian.
fair
I will always
I
try to be
always try
fair
to be fair
in all my dealings with my fellow human beings.
in all my
in
dealings with my
dealings with
fellow
my
human
fellow human
beings.
In
beings.
all,
I am a Rotarian.
I am a
I am a
Rotarian.
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 I will always endeavor to
I
build
am a
goodwill
Rotarian.
I will always
Endeavor
to build goodwill
and understanding in my community,
And
and understanding in my community,
among my countrymen,
among my
my
countrymen,
countrymen
And
and among
understanding in
peoples
my
of all
community.
nations.
and among
among
peoples of
my
peoples of all
countrymen.
nations.
I am a Rotarian.
And
I am a
I am a
Rotarian.
Rotarian.
I will always seek to
I
promote the
am a
greatest good
Rotarian.
I will
I will
always
always
seek to
Always
promote the
seek
greatest
the
good
greatest good
for the greatest number of people in the spirit of Rotary service.
The
for the
greatest
greatest number of
Number
people
of
number of
in the
spirit
spirit of
Rotary
Rotary
service.
the
service.
greatest
I am
number
a
of people
Rotarian.
in the spirit
I
of
am a
Rotary
I am a
Rotarian.
Rotarian.
I will always observe Rotary International's motto,
I am a
I will
Rotarian.
always
Always
observe
observe
Rotary
Rotary
International's motto,
Motto,
service above self.
service above self.
above self.
Ani, you open your hand. Is it open? You're not yet open.
And now, for the work
Service
for
above
test, our Water and Sanitation Director, MK Lai.
Hello, everybody. This is the
Hello.
of all the things we think, say, or we do. Number one, is it the truth?
Is it the truth?
All concerned
Is it fair to all
Is it
concerned?
fair to all concerned?
and better friendship.
Will it build goodwill and better
and
friendships?
goodwill and better
all
friendships?
concerned,
Repeat because ano.
goodwill and better friendship.
Alright. Hear you? Oh, there's something wrong with that. Okay na po. Narinig nyo? Sorry.
Will it be beneficial to all concerned?
Oh,
Will
yeah.
it be beneficial to all concerned?
Oh, yeah. He speak, but maybe some problem with his, audio. Anyway, it's okay
Okay.
na po.
Okay, for our welcome remarks, let us welcome our club service chair, our past champion president, AG Catalina Bagsik.
Thank you, Glenn. Good afternoon and welcome to our webinar on COVID-19 updates. Isang napapanahong paksa para sa ating lahat. Tayo po ba ay pagod na o exhausted ng mga informasyon o balita tungkol sa COVID-19? Ang Pilipinas po ba ay kabilang sa kategorya ng tinaguriang in a disaster mode? Nasaang antas na po ba tayo ngayon? This afternoon, we are privileged and fortunate to have with us the single most qualified person in the Department of Health to address us on these current updates, our very own Dr. Eric Tayag. Of course, who would not know Dr. Eric, a fellow Rotarian and the man of the hour, but he will be properly introduced later. Likewise, our warm welcome and appreciation to the team captain of District 3810, the very hardworking and indefatigable District Governor Robert Coa, the equally hardworking district officers headed by COSB and DS Edwin, the supportive, life-changing presidents, and to all the other guests and attendees, I will not mention anymore in the interest of time. Thank you for spending your precious Sunday with us. Together, let us continue to be well-informed and updated on COVID-19 facts, issues, and developments. Again, on behalf of the Rotary Club of Manila Supreme 198, we welcome everyone to this life-changing webinar. Mabuhay tayong lahat, mabuhay ang District 3810. Thank you.
Clap, clap. Can I be heard?
Thank you, AG Catalina Bugsik, for that wonderful welcome remarks. Now for the introduction to our guest of honor, our Charter President, AKS Maria Rosa Bingcarion.
Thank you very much, PE Glenn. A warm, wonderful Sunday afternoon to everyone here present. I shall not mention anymore everyone because AG Lina's already done that. I am very proud to introduce our current governor, life-changing governor, Robert Coa. Governor Robert joined the Rotary Club of Bagong Bayan in 2004. He is currently our life-changing governor, but before that, he kept winning all the awards that were being given by our district. But there are 4 facts that I'd like to share with all of you about Robert Coa. Do you know that Robert Coa loves Rotary above all? Of course, after Arlene. He is the type of a Rotarian who is so faithful to the Rotary vision and mission. And do you know that actually that after he won as governor, he individually called all his life-changing presidents to get to know them each one. That's over 115 persons. But that's how dedicated a leader he is. He gives honor to each person, and he wanted to know all of his LCP presidents so he might be able to know how to deal with them. But most of all, one thing you should know about our governor is that he has such a good heart. He will help you as much as he can. And he is such a dedicated governor that we are actually so honored and proud that he has accepted to serve for Rotary year 2021-2022 as our life-changing governor. Ladies and gentlemen, I want to present to you our governor, Robert Coa.
Good afternoon, everyone.
Good afternoon.
Thank you, LCP. Thank you, Charter President Bing Carion, for that wonderful introduction. And of course, I would like to thank our speaker, the very famous WHO, Department of Health speaker, Eric Tayag. And of course, I would like also to thank LCP Madel for inviting me this afternoon. This morning, I received a very sad news about one of our very own, LCP Joe Santiago of Rotary Club of Chinatown Circle, and he was stricken by this very deadly disease, COVID-19. I'm thankful that this webinar is so timely, especially right now that this variant, which they say are very transmitted, is so easily to be transmitted. No? So I think that this webinar, everybody must pay attention and make sure we take the necessary steps to prevent any of us from getting sick. It's a very, very difficult time to get sick. I, for one, am very sad about what happened because of this ECQ this quarantine again. I was looking forward to have some face-to-face meeting, but because of this very deadly disease, we need to step back and do the right thing. Keep everybody safe, keep yourself safe. So please pay attention to what our speaker will be telling us. And he is, of course, the man, no? He knows what he's talking about. No? And without further ado, thank you everyone for attending. I know there are so many of us today. There are already 72 of us, and it's a Sunday. You believe Sunday afternoon, and there are 72 participants in this webinar. So I don't want to delay our speaker. Good afternoon, and please take special attention on what Dr. Tayag will be telling us to do.
Thank you po, Doc. Thank you. Thank you very much po, Doc Robert.
All right, thank you, Governor Robert Ko, for that wonderful message. Okay, now let's call back Maria Rosa Bincarion for the introduction to the speaker.
Thank you very much, P.E. Glenn. I have the honor to introduce our guest speaker, our man of the hour, Dr. Eric Tayag, who was a past president of the Rotary Club of Manila 101, who is our mother club. I met Dr. Eric a few years ago when we invited him during our charter presentation at the Shangri-La Makati. And from then on, we became very good friends. If there is anything we can say about Dr. Eric, he is a most dedicated and professional worker of the government. If there is one person that uplifts the Philippine government, it is in the person of Dr. Eric Tayag. One information you need to know about this man is that 3 years ago, he was awarded the most prestigious award as the most dedicated government civil servant. And this, it takes a year to actually vet everybody who is nominated for this award. And Dr. Eric won this hands down. And for Rotary, that is such a great honor. So having said that, ladies and gentlemen, I want to present to you with great honor the dedicated, the very professional, the very knowledgeable Dr. Eric Tayag of the DOH and actually of Rotary Manila 101. Take it away, Dr. Eric.
Thank you, Bing. I feel you for that introduction. Magandang hapon po, DJ Robert Kowa and everyone, and congratulations to Manila Supreme 198 for this special edition ng ating webinar. I'm going to share my presentation now. Glenn, how's the audio?
Very good.
Kita na ba yung slide, Glenn?
Yeah.
Yes,
Yung
yes,
audio?
yes, Doc.
Okay,
Yeah.
thank you so much. Okay, so COVID-19 updates for Rotarians. This presentation was especially made for you. Just today, the Department of Health announced that as of August 15, there are a total of 1,741,616 cases since the start of the pandemic. And the number of deaths has already totaled 30,340. Please take note, at the middle of your screen, there were over 59,000 who got tested, and this represents a 23.5% positivity rate. Below on your screen is an indication of our health capacity. Over to your left, for the Philippines, the the intensive care unit bed utilization is now at 70%. The isolation bed utilization is at 60%. The ward beds dedicated for patients is now at 61%, and the ventilators is at 51%. At the lower middle, you will see that the utilization rate for the ICU in the National Capital Region is at 71%. For isolation beds, it's 64%. For ward beds, 63%. For ventilators, 56%. Translation, if you get sick and you need to be hospitalized, no room for you in many of the hospitals. We are under enhanced community quarantine. What does this mean? The following are not allowed: the movement of those less than 18 years old and more than 65 years old. The only ones who can actually get out of their homes are those between 18 and 65 years old. There is an exemption if there is a senior citizen more than 65 years old that needs essential goods or services. Not allowed public transport that do not comply with protocols. Not allowed face-to-face classes in all school levels. Not allowed mass gatherings except for delivery of health services, for example, vaccination. That's why vaccination with COVID-19 vaccines continues. Government services, of course, we cannot shut down. And humanitarian activities. So, even during enhanced community quarantine, humanitarian activities delivered by Rotarians, they are allowed. Not allowed social gatherings outside of residences. Say you get an invitation for a reunion, for a wedding, that's not going to happen, they're not allowed. Social gatherings at home with any outside guests, not allowed. Religious gathering except for necrological services, wake, interment, funerals, and only limited to immediate family members and those officiating such rituals. Not allowed individual outdoor exercises before 6 a.m. and after 9 a.m. So if you are into outdoor exercise, you just have a window of 3 hours, that's 6 a.m. to 9 a.m. Indoor dining or al fresco dining, not allowed. Operations of all tourist attractions, entertainment with venues with live performers, MICE, that's meeting, incentives, conventions, all recreational facilities, amusement venues, cockfighting, horse racing, lotto, hotels with no valid DOT accreditation, not allowed. Delta variant. There's breaking news. The Philippine Genome Center just detected the Lambda variant. This variant was announced by the WHO just in June this year. It's the variant everybody is actually on the watch because any vaccines currently used may not work against the Lambda variant. But it remains as a variant of interest. It has not been upgraded by the WHO to this group of variants of concern, which include the Alpha variant, the Beta variant, the Gamma variant, we don't have it yet, and the Delta variant that has been spreading in many communities in the country. But can we do more on what government is doing, what individuals, family, communities are taking part of? A four-door strategy for your understanding. Door one is to travel ban and restrictions. That's how we can get these variants from other countries. And now you will understand why certain travel from a list of countries are forbidden, except if overseas Filipino workers will be coming home. Door two is the point of entry, screening, quarantining, testing at point of entry. Please understand that door one and door two are not surefire lines of defense because we have the variants and now we have lambda. Door three is the point of care. This is how we can prevent, we can detect cases, we isolate them, we treat them, and we are able to vaccinate as many Filipinos as we can, as fast as we can. And the last door is enhancing our compliance with the health protocols. But the question is, can we do more? Must know. One, anyone can get infected with the SARS-CoV-2. Not everyone who gets infected will get sick. Not everyone will have symptoms or will have the same symptoms as another individual who gets sick. Sick people infect those close to them, and most likely your family, your co-workers. You can remain asymptomatic even if you get infected. So there are no telltale signs you are infected. You can infect others even if you are asymptomatic. Now you will understand why we have to wear masks, even if you don't have symptoms. Not everyone will be hospitalized. Many will recover. Many can stay home. Those hospitalized may die, and it just takes a few days. Those who recover, and this varies from a few days to 1.5 months, may still have lingering symptoms even after being discharged in hospitals. And there is still no treatment for COVID-19. None. So, why are there more people getting sick? Especially here in Metro Manila and in many countries for that matter. Number one, the Delta variant, among many variants, are highly transmissible. Look at this picture as I describe to you how transmissible it is. The original SARS-CoV-2 from Wuhan, that's in China, an uninfected person can spread it to 2 more persons. The Alpha variant described in the United Kingdom can transmit up to 5 people. How does the Delta variant compare? Uninfected person can transmit it to 8 more people. Then you'll say, well, it's close. It's 1:2 for the original. For alpha, 1:5. 1:8. Now I'll tell you what happens if it propagates to 5 generations. After 5 generations of transmission, the original strain can infect 32 people. But for the Delta strain, starting with 1, after 5 generations, 32,000 people. 32 versus 32,000, that's 1,000 times transmissibility. Social mixing is very dangerous. When you go to crowds, especially if it's indoors, okay, it's the mixing because everybody wants to open the economy. And who can blame us? We need jobs. We need to earn. We need to survive. But social mixing is very dangerous, especially if safety protocols are often violated. When do we violate these protocols? When outdoors you're not wearing masks. You complain about extra protection with face shields. We don't regularly wash our hands. We forgot our alcohol spray. And when they tell us to keep the distance of at least 3 feet, it's suddenly forgotten. And look, you've seen so many videos in the news, even in vaccination centers, that these are not actually observed. And of course, vaccination. It's unevenly available. WHO is not so happy about this. Only 5 countries have reached already 70% vaccination coverage for their population, while the rest, many countries haven't started yet their vaccination. That's not acceptable according to WHO. Must have. If they are not on your list, now is the time to make them on your list. Emergency numbers. Go back. Earlier, when Boss called me about LCP Joe's condition, I called her and already gave her instructions after making an assessment that she should have her go bag ready because at any time she will have to be transported by ambulance to the nearest hospital that can accommodate her. What's a go bag? It will be difficult for you because bantais are not allowed when you get confined in a hospital. And if you need things that are important to you and you didn't pack them in your go bag, it will be difficult to get them while you are in the hospital. Mask, face shields. Huwag tayong magtipid. Okay? And here's something about masks. When you're going out outdoors, safe. But when you go indoors, if it's essential, okay, if you're just using the surgical mask, double mask is recommended. So the surgical mask, the blue outside, okay, it covers your nose and mouth, but it's not snug to fit. So you need another mask, not a surgical mask. A face covering or a cloth mask, you actually wear it over the surgical mask. That will make sure that it snugly fits now your nose and mouth. But if you have the N95 mask, then you use it and you don't have to use a pair. Alcohol spray, thermometer, and earlier I announced that for the raffle, okay, I will donate for the winner. And Madel, okay, and I hope somebody wins. It's this thermometer. Okay, I hope you get this and help you make sure that you check your symptoms and all the members in your households. Pulse oximeter, that's to measure your oxygen saturation. If you get the reading below 92%, you are in danger, especially if you have fever, cough, and you are short of breath. A nebulizer, you may use this. Tuo, paracetamol, vitamin D3, maintenance meds, a stable internet, a PhilHealth membership number when necessary, and senior citizens cards, because this may be required so that you can have discounts if you get hospitalized. So who do you kind of call? So here we give you the numbers. There's only one number you should remember: 1555. This is the DOH COVID-19 hotline. It allows you to talk to a call center agent, and if it's teleconsultation, telemedicine volunteers are on standby. And if there's a long queue and you want teleconsultation, we have listed here our telemedicine partners that you can get in touch with, so that if you are fearful or your primary provider is not available in their clinics and you don't want to go to the clinics, telemedicine is your next best option. Must do. Okay. 10 S po yan. Stay home. Skip crowds. Stock on mask. Stay away from others by 3 feet. Silence yourself. What do I say? If you're outside, you're at work, and you're going to eat, just eat, don't talk, don't sing. Because this is a time you don't have your mask on. And if you talk, if you sing, that's how you spread it, especially if you are actually infected. So, Bob, you have to hand your hands. Spray alcohol. Symptom check daily. Get your temperature before anyone leaves the house. Do you have cough? Do you have fever? Be strict about it. Seek assistance if you have any doubts about your condition. Call 1555 or else contact me. Secure your vaccination. The best vaccine is the one you get in your arm already. Twice. Once for Janssen. Must not do. 10 ends. Non-essential travel, non-essential visits, not wearing masks, not doing self-quarantine, not getting tested, not informing health authorities, not completing quarantine or isolation, not getting vaccinated, not completing the vaccination, not observing health protocols after vaccination, because we can still get sick even if we get vaccinated, and not reporting serious symptoms after vaccination. Have you been vaccinated? In the Philippines today, 13% of the population have been partially vaccinated. 11.1% have been fully vaccinated. This is as 4 days ago in August 13. Here we show you, because you might worry about side effects after vaccination and so you hesitate. If you visit the FDA site, it will tell you that as of August 1, out of a total of over 9 million fully vaccinated and 11.7 million partially vaccinated, and with a total of 20.8 million doses administered, only 0.26% reported adverse reactions. And the serious reactions, only 0.007%. Now, more females are reporting side effects after vaccination compared to males. And as to the age group, it's the younger people who are reporting side effects after vaccination. And here are the vaccines and their rates of serious side effects. CoronaVac is your Sinovac. AstraZeneca Sputnik V, that's from Russia. Comirnaty is your Pfizer. Moderna, Janssen are from the US. Here, it will tell you that Janssen has the least proportion of serious side effect, followed by Pfizer, that's Comirnaty, and the third one is Sinovac and Pfizer. Sinovac and Pfizer in this report has one for every 10,000 vaccinated, and they will have serious events, but not related to the vaccine so far, and that which can be managed. So I'd like to thank the members of the COVID Prevention and Awareness Committee that made this possible. We have TP Len Francisco of RC Tondo, PP Maria Luel Sibunga of RC Pasay Silangan, PP Arnold Zenarosa of RC Rosario, and PP Jerry Rosete of Mindoro. Maraming salamat po. Mag-usap na po tayo ngayon.
Thank you, Dr. Eric, for that very timely presentation for us and for the good news also. Ayan. So, for any questions po, you can type it on the chat box, then babasahin po namin kung meron po mag-ask ng questions. Okay. So, my question po, LCP Monespera, may we have a copy of this PowerPoint presentation? Okay. A thumbs up for Doc Eric. So, you may leave your email address on the chat box or just PM us. Anyone? Sino pong gusto magtanong? Any concerns? Yan. Feel free to type it in the chat box.
Glenn, they can also raise their hand.
Okay. All right. So, one is raising his hand. LCP Dr. Hill Dineros.
Hi, Doc Hill. Nice to see you here.
Hi, Past President Dr. Eric, famous Dr. Eric Tayag. Good afternoon. I have a confession to make, Doc Eric. And can you hear me?
Yes, we can. You have very good audio. Please continue.
Yes. As I said, I have a confession to make because I haven't been following up the Department of Health for so many months already. In fact, I am trying to get away from the information that the Department of Health is actually exposing, simply because I get to be so-called numbed by the manner that we actually appreciate information. But because you are there right now, again, I have to come back and get to be updated. I was expecting this. I was anticipating so much itong ating meeting. Why? Because I know that you'll be giving us the so-called information that each and every person would be needing, not necessarily medical professionals, but everyone else in the Philippines today. First, I just have to commend you for being there and standing up for the health of the Filipino, especially that in these trying times, we don't know exactly what we're supposed to follow. But we look up to guidance from, say, government ordinances, rules, to actually come up with some ways of being strict in terms of its truthfulness and I would say abiding with what truth is all about. The reason why I'm saying this is because I'm looking at things from outside of the box. I know you're inside that area where you're actually appreciating information But really, the first slide that you presented, Doc Eric, um, medyo medyo different lang yung way of approaching it in terms of disseminating the message. Alam ko na kinakailangan magkaroon ng awareness yung mga tao with regards to prevention. But if it comes to that point that the information would create some degree of fear or even affect the activity of people, then it's something that we need to actually deal with and do something about it. Can you still hear me?
Yes, yes po.
So what I'm
Yes,
saying,
we can hear.
yes, what exactly I'm saying here is that baka kailangan saan ba yung forum, Doc Eric, na yung usual logical, rational mind would be able to express and be heard by the government, the Department of Health, and everyone else. Because if, based on the presentation that you have given us today, which I would say would express some uncertainty in terms of where we are going, what are we dealing with, and what are we doing right now. Saan ba tayo pwede magkaroon ng forum na makapa-express tayo the different narrative pagdating dun sa management ng issues na ito. I wouldn't even call it a pandemic thing pertaining to the COVID, because the numbers are not just right there. As I was looking at the mortality rate, for example, 30,000 mortalities over a year period, and I'm going brushing through the mortality rate caused by other diseases like diabetes, for example, as we are doing this in Rotary as well, eliminating diabetes. It's even higher. And looking at the way that we look at active cases as simply positive PCR tests. There's just so many things na mayroong disconnect. And that's just the start of the discussion, Doc Eric. Ito lang yung aking sentiment personal. It's kind of hard for me because I was trained, I was educated to be a physician and follow certain rules that would actually guide us as to how we appreciate information so that we come up with a way of dealing with health issues and diseases of people. And malaki kasi effect, hindi lang disease, kundi yung buong life ng bawat Pilipino nakataya dito.
Okay, thank you,
yes,
Dr. Hill.
Okay. Salamat po, Dr. Eric.
Okay. To answer you, what forum? This is one of them. That's why
yes.
Madel and her team are so laudable. And DJ Robert Kowa in his message made it clear that this webinar, we now have 84 participants, is very important. And this is actually a forum wherein you can share, okay, your doubts for anything, your comments. I'm going to accept it, and umasa ka, Dr. Hill, na makakarating to sa mga kasama ko sa DOH. Number 2, yung pandemic, sinasabi yung we don't have the number. Paliliwanag ko lang kung ano yung pandemic. Okay. Matatandaan nyo, sinabi ko kanina, everyone is susceptible. So just one case is already an outbreak. Okay? So nagkaroon ng outbreak sa China, kumalat yun sa ibang bansa because of travel. At kung marami ng bansa ang naapektuhan, in fact, ang definition po sa pandemic, if it goes beyond one continent, okay? Ang dami ng continents ang naapektuhan. Pag pumunta kayo sa WHO website, nandun ang listahan ng mga bansa at yung mga reported cases and deaths po nila. Pangatlo, Dr. Hill, yung deaths na yan, underreported yan. Kasi nga, dito sa Philippine Statistics Authority, pag pumunta kayo sa website, hindi lang yung confirmed cases ang binibilang, pati probable. So by this time, baka doble na. Kung 30,000, baka 60,000 na yung namatay. Okay? Nung katapusan po nung January to June, number 16 lang, wala sa top 10 itong COVID. Okay? Pero tumataas na po siya at ang number 1 pa rin ay ischemic heart disease, cancer, cerebrovascular disease. Okay? Yung pneumonia, binukod na po sa COVID. Okay? So talagang tataas po yan. At ito po ang sasabihin ko, Dr. Hill, maapektuhan po yung mortality rate sa ibang sakit. Kasi kung puro COVID ang tinitingnan ng ospital, yung mga kawawa nating kababayan na may ibang sakit, mamamatay din kasi wala nang titingin sa kanila. Kasi puro COVID na lang yung nasa ospital. Okay, naintindihan ko ang iyong pananaw, subalit pinaliliwanag ko nga rito, it's not about the numbers. Yung nire-report po ng DOH ng numbers is to tell you our situation, okay? Hindi po perfect yung report na po yan. Unang-una, ang binibilang natin yung nag-positive lang at saka nagpa-test. Maraming hindi nagpapa-test. Maraming lugar ang walang pan-testing. Maraming inuubo dyan. Hindi nagpapa-test kasi hindi kaya yung bayad. Walang pambayad. O kung may pambayad man, nahihirapan magpa-test, nahihirapan magkuha ng appointment. But thank you for your question, and this is one forum for all of us. Thank you, Dr. Hill, and welcome back.
Thank you, Dr. Hill, for that. Ayan po. So, basa muna tayo ng data from Red R. Okay, so sana maging responsable district natin. Stop encouraging Rotarians in your training sessions and face-to-face relief goods packing. Ayan, yun yung parang suggestion. And sa nag-raise ng hand, may we call on GP Marian Dizon. Unmute yourself po. You're unmute po.
Hello, Dr. Eric Tayag. I'm your classmate, GP Marian Dizon. I hope you remember me.
Yes, GP Marian. Nice to see you here in our
Thank you so
special
much.
meeting. Yeah.
Thank you so much for enlightening us with COVID update. And on behalf again of our club, Rotary Club Chinatown Circle, thank you so much for the help extended to our LCP Joe Santiago. And you just don't know how much we are so grateful for that. Nonetheless, my question is, I have been having this protocol in my clinic wherein I have to do a swab antigen testing to all my patients. I just feel that it's more safer for me if I do that. And after having done that, many of my patients are even grateful. I just want to ask whether the swab antigen testing that are available in the market is really that effective. Particularly, I have the Clungene brand. That is what I use. I do the nasal swab testing.
Okay, thank you, GP Marian. If you go to the FDA website, nakalista doon yung mga approved tests and you can check the brand na sinabi mo and doon makikita mo if it was actually one of those that have been approved. Ngayon, yung nagpapa-approve ng test sa RITM po ginagawa yan.
Okay.
So, okay, bago yan ipalabas sa merkado. So, kung yan po ay kasama doon sa listahan, so you can rely on the results. But I have to say, ang gold standard po, kung kailangan ng mag-diagnose po, ay yung RT-PCR pa rin. Yung antigen test, nire-recommenda lang ng Department of Health sa mga lugar na walang capacity sa RT-PCR testing. Okay. Ngayon, sa mga ilang pagkakataon, kung maganda yung health screening mo sa clinic mo, you can correlate the antigen testing and hopefully yung pumupunta sa clinics mo will actually answer accurately yung iyong health declaration form. Okay. Tapos paalala ko lang GP Marian, it works two ways. Okay. So, pag ina-antigen test mo sila is to make sure yung pumupunta sa clinic mo ay hindi makapangahawa. Hindi lang sa iyo, kundi sa ibang pasyente mo. But secondly, it works two ways kasi ikaw, pwede ka rin ma-infect and you can spread it to them. Okay? Oo. So, maganda ginagawa mo, but you should have a backup plan. So, okay. Tingnan mo if magiging relevant sa'yo ang mag-telemedicine ka. Okay? If you want that, we can give you an orientation how to do it. Thank you, GP Marian.
Sorry, may I have a follow-up question? So,
Sige.
I have been exposed 4 times already, and 2 of my patients were found to be COVID positive and traced me. By the way, working 2 ways, I also do mandatory testing for me and my staff. And unfortunately, 2 of my staff they were COVID positive. Apparently, they are already okay now, but they have refused they have refused to having even if I have insisted to having the RT-PCR for confirmatory test. That was my fault because I did not really inform them. I mean, I have informed them, but they are refusing. So they did just the isolation at home. And again, unfortunately, the mom was infected. But like right now, that has been like 2 months ago, we did another swab testing and they are already okay. And I think now they are already Sinovac vaccinated. I'm just being transparent that, somehow with Dr. Hill have said, there are also patients or people who don't really would like to inform the government or the LGUs of, probably because they are, in fact, they told me that they are they did not want that the neighbors would know. That was before the surge. But like right now, at least they already knew that they had to be vaccinated. It's just, I'm just sharing
Okay.
it.
Thank you, GP Marian. It's understandable because may mga discrimination at stigmatization dun sa mga nagpa-positive. In fact, we hear stories sa mga barangay, nilalagyan pa ng yellow line yung mga bahay na kung saan merong confirmed case. Hindi dapat ginagawa yan kasi parang scarlet letter, minamarkahan mo ang isang bahay. Ngayon, ang disadvantage pag hindi sila nag-report, ang gobyerno natin ay hindi makakapag-initiate ng contact tracing. So kung hindi makakapag-contact tracing, yung maaring nahawa sa 2 personnel mo, ayun, maaring nagkasakit na, hindi nila alam nangyari o tapos sila nahawa pa nila yung iba. So dapat wag tayong matakot na mag-report. Kung meron pa nga abuso, kailangan i-report. Pero dapat pag tayo nag-positive, i-report natin sa barangay yon para merong contact tracing. Thank you, GP Marian.
Thank you, Dr. Eric. Appreciate it.
Okay. Thank you, GP Marian, for that. Basa po tayo ulit ng isa sa chat natin. This is from CS Sally Panlilio. Okay. Hi po, Dr. Eric. May I ask if even we are fully vaccinated, do we need to have anti-flu and anti-pneumonia vaccines?
Okay, the flu vaccines and the pneumococcal conjugate vaccines or another pneumococcal polysaccharide vaccines are recommended for senior citizens. Yung sa pneumococcal, yung sa pneumonia at invasive disease, okay, due to Streptococcus pneumoniae, binibigay yan starting at 55 years old. You may or may not get another dose after 5 years. Itong influenza vaccine are recommended for senior citizens and you have to get the vaccine every year kasi nagpapalit ng formula po yun. At ang magandang balita, yung stocks namin sa flu vaccine ay dineliver na po namin sa health center at libre po yan. Pangatlo, ito po ay pwedeng ibigay sabay sa COVID-19. Wala na po yung regulasyon na maghihintay pa ng 14 days. Yung iba naman, naghihintay ng 14 days kasi kung magkaroon ng side effect at pinagsabay, hindi malaman kung yun ay sa flu o sa COVID-19 vaccine. So yan po ay choice po ninyo. Pag-usapan po ng inyong doktor para sa ganun ay mabigyan kayo ng guidance. Thank you.
So, may nare-raise pa ng hand. May we call on LCP Janadin Gubat of RC Manila Quirino Central?
Yes, good afternoon, Past President Dr. Eric Tayag. Sir, my question is regarding the vaccinated people. Is there any regulation or any future plan to exempt the vaccinated people from undergoing PCR test and swab test when traveling by air and by land or by sea, considering that we undergo vaccination because we want also to have that benefit to be free from any test.
Thank you, LCP Janoden. Yan po ay mangyayari kung marami na po ang napupunahan, hindi lang sa Pilipinas, kundi sa ibang bansa. Kaya nga ang WHO ay nalulungkot kasi hindi pa nga nagbabakuna sa ibang bansa. May mga bansang hindi pa fully vaccinated, yung mga nabakunahan. May mga bansa nauuna na magbigay sa 12 to 17-year-old. Sa China, starting at 3 years old. At may third dose nang binigay sa United Arab Emirates, yung booster dose. At maraming bansa ang ayaw makinig sa WHO. Mauubos po yung supply natin, hindi po makakatulong. Kayo po na nagbabalak ng third dose, huwag niyo pong gagawin yan. May nahuli na sa Quezon City, napakunahan na, tapos pumila pa ulit para sa ibang brand. Huli! Kasi po meron tayong records yan, huwag niyong gagawin. So LCP Janoden, na mangyayari dyan, hindi pa ngayon. Kung sakaling mangyayari yan ay siguro sa mga overseas Filipino workers natin. At yung certification yan ay manggagaling sa Bureau of Quarantine. Inaayos po ng DICT DOH para kung kailangan nyo ng certification, hindi lamang sa travel, sa trabaho, sa eskwela, at kung ano pa mang dahilan, ay ma-authenticate po yung vaccination cards nyo. Sapagkat kung vaccination card lang yung hawak nyo, napepeke po yan. So kailangan ma-certify. So inaayos po yan ng DOH at DICT. Sa ngayon, hindi pa po yan. At ito, pinag-aaralan na rin ng WHO at saka IATA. Kasi may mga bansa na mimili na ito lang ang tatanggapin naming traveler. Pag ang bakuna ay Pfizer, Moderna, AstraZeneca, labas dyan, hindi namin tatanggapin. Hindi naman pwede yun. Kasi itong mga bakunang to ay nasa emergency listing ng WHO. Thank you, LCP Chanot.
Thank you, sir, for enlightening us.
Okay, so one again on the chat. From our IP Italy. Okay. Doc Eric, may I know your opinion about ivermectin?
Okay, ivermectin has been a controversial medicine. It's an antiparasitic drug. The evidence is not that strong. There are studies that doesn't say it's beneficial. But because of the push of the FLCC group, okay, many countries have actually tolerated the use of ivermectin either on a mass ivermectin campaign or an individual basis. We know here in the Philippines, because the FDA allowed its registration, that many are actually getting ivermectin online or from other sources, and they have stocks in their homes and they're actually taking it. If you have to take this ivermectin, Please don't. But if you insist, please make sure that you contact a health professional so that you may be guided, because there are serious side effects associated with the use of ivermectin. If and when ivermectin is actually approved, then you will get the news immediately from the DOH and FDA that you can actually use it. I know that many will give their testimonies, and you can find this in social media, that with ivermectin, they actually recovered. But please, these studies are done so that we can have solid evidence. And right now, it's not evidence that we want, that we can already outrightly recommend ivermectin. Over.
All right. Thank you, Doc Eric. Okay. Um, let's call on John M. Cutter. Mr. John M. Cutter.
Hi, thank you. Good afternoon, Dr. Tayag. Thank you
Good afternoon too.
For a very enjoyable presentation and very prudent information as well. I have a question on data. In the end of your presentation, you posted a slide that showed that there was a population penetration of 13% for vaccination. And as of last week, the government reported through DOH and IATF that they have a 22% penetration. Where's the disconnect in those numbers?
Okay, the numbers presented to you is based on the full vaccination, that's 30%. The 22% is the total number of doses proportion that have been administered. So there's no actually discrepancy about that. But when we look at the figures, and these are available on a regional basis, the National Capital Region has at least vaccinated half of its population, but the other regions are lagging behind, John. And so that's why I told everyone there is an even vaccination, and we hope to catch up, because to get herd immunity, that's the combination of the population that had natural infection plus those who got protection from vaccination. We don't actually know the actual threshold, but many say it's at 85%. So we don't know if that's going to stop the spread of the virus. But there's an indicator that's important, the 23.5% positivity rate. The positivity rate is the number of those who tested positive for COVID using the swab gold standard RT-PCR, and the denominator is the number of persons who get vaccinated. The threshold is 5%, John. If it's less than 5%, we can open the economy. But if it's more than 5%, which is now 23.5%, the interpretation is that there is transmission that is unchecked, so it's spreading so fast, or there are more people who are not getting tested. Either way, it's a bad situation. Thank you, John.
And can I follow up on that, Eric? Just a quick
yes, John.
Just a quick question. I keep following the IFR, the infection to fatality ratio, and I've noticed that even in the case of increasing infection cases being identified, the IFR hasn't really budged downward below 1.5 since about the middle of the first year of the pandemic. Wouldn't you think, as an epidemiologist with an increasing denominator effect, that that number should be moving downward? And if not, what would be your reasoning why?
Okay, John, that's a paradox. Globally, it's 2.2%. Ours is between 1.5 to 1.7%. So you'll say we are in a better situation in terms of death rates, but let me explain. 1.5% translate 1.5 or 1 up to 2 individuals out of 100 will die. Okay, that's 1.5%. Okay, let's round it up to 2%. So for every 100 cases, 2 died. Okay, so that's your 2% case fatality rate or mortality rate. So you'll say, well, only 2 out of 100, it's 2%, nothing to worry about. But let me say this. If there are 1 million cases, so you don't have two deaths. 2% of 1 million is 20,000. That's big. And so therefore, it's a paradox when you read the news or reports that it's only 2%. The more cases, the more deaths. And what does it imply? Before they die, they will seek hospital services. And if our hospital services are overwhelmed, they will surely die. And so therefore, I shared to you our health system capacity. It's over 60%. We're running out of isolation beds, ICUs, ventilators, the works. And so therefore, we want to make sure that spread is actually cut short as fast as we can. But exactly how? So we have to understand how this virus spreads and how we can, as individuals, can contribute so that it's not spreads and infect many people. Thank you, John.
Thank you, Doctor.
All right. So, let me call on LCP Honey Reyes.
Hi, good afternoon. Doc, I have a question regarding the apat dapat by the Health HPA Act, which is Healthcare Professionals Alliance Against COVID-19. So yung apat dapat stands for apat: air circulation, physical distancing, always use face mask and face shield, and time of interaction should be shortened. Is there any support from the DOH regarding this, that COVID-19 is airborne, so that we can also promote it? We can also promote, for instance, ventilation in our activities in Rotary. Thank you, Doc.
Okay, thank you so much. Making sure that ventilation is something that will keep the virus away is not something that's easy. It's an engineering, okay? It's an engineering imperative, and it's not as simple as opening the windows. It's not as simple as having something that blocks the virus from keeping themselves indoors. Okay, there are engineering controls, and this should be done by a professional. So when you say that indoors, you just open the windows and it's all right, it's not going to happen that way. So better get a professional so that any space indoors that requires ventilation, you can get the proper instructions of how to do it. Of course, as a message, when they say that there has to be good ventilation, open windows, exactly, the message there is that actually the opposite. Don't go indoors unless it's surefire that ventilation has been taken care of. And if you go indoors because it's essential, mask, double mask, remember that. And don't stay longer as necessary. So don't stay 1 hour getting your groceries. You can get them by deliveries. Or if you have to go to the grocery, make sure you have a list. Okay, don't spend so much time in the grocery. Get out as soon as you can. Over.
Thank you,
Thank you,
Doc.
Doc.
Thank you. So we have a lot of questions here. So maybe, Doc, we can read all, or we will read po all yung questions, or okay.
Yes, we can continue. I don't know how much time you have actually allocated to this, but as long as Rotarians want to know and I can clarify, yes, I
Okay.
can. And just one word. The information I have shared today is something that should be there should be caution because it is based on the available information we have. It's possible that a few hours from now or tomorrow there's new information, and so therefore the information I shared today is passe. It's old. That's why it is wise to get veritable information so that we will be guided with proper precautions so that we can all survive this.
Alright. Okay,
Okay,
so
Glenn.
read po tayo ng another chat. From LCP Romel Rojas of RC Malate Friend. Unfortunately, my family and I have not been vaccinated yet. Have registered since June here in Cavite but haven't had any schedule yet. Okay.
You can give me the chat. I can contact authorities in Cavite and just maybe make arrangements so that you can get vaccinated. But please remember there are priorities for individuals who should be vaccinated. A1 are the frontline health workers. A2 are older persons, 60 years and above. A3 are those with underlying conditions like diabetes, obesity, heart disease, strokes, cancer, tuberculosis, asthma. Okay, and number 4 are the essential workers. That's A4. A5 are poor communities. So these are the first 5 priority individuals or communities or populations that will get the vaccine.
Okay. So
Just give
next.
me your just give me your names in the private chat, and I hope I can contact Cavite so you can get your vaccine. Thank you.
Alright, thank you, Doc. Okay, this is from LCP Janice Azarias of RCCM Recto. Which kind of doctor should we initially consult with for mild COVID cases? Pulmo or infectious diseases, Doc?
Okay, first you can try the 1555 telemedicine. Any doctor that is available to you, even if you actually contacted a surgeon, that's not a bad idea because they can always refer to you to a doctor that is relevant to your needs. Okay, so if a doctor, call any doctor, don't choose, okay, because these doctors, if they're not the right doctors, will refer you to the right ones. There's in the chat here, let me read them. Tocilizumab is prescribed for the treatment of COVID-19. When I looked it up in the MIMS, that's a compendium of drugs medicines available in the Philippines. It is used for the treatment of rheumatoid arthritis. Can you please clarify the relationship for arthritis to viral COVID? Number one, there's no treatment for COVID. These drugs or medicines that are being used for COVID patients are repurposed drugs. Means that their original indication, they have been repurposed for use for COVID because of clinical trials that showed there is some benefit when these drugs are used. So I hope that clarifies that. For example, remdesivir is a drug used during the Ebola outbreak. It has been repurposed so that it's used now for COVID-19 critical patients, those in critical conditions. There's no treatment, but we have to use this, and there is enough evidence that it can be beneficial to certain patients. Thank you.
Okay, thank you, Doc. I think I have to read more. This is from our member and spouse of our LCP Mandel, from MK Lai. Then he already had AstraZeneca vaccine. How much confidence can I expect to be more protected against the Delta variant?
Okay, right now the reports are telling us that any of the currently used vaccines, that includes AstraZeneca, has protection still with the Delta variant. But there are reports that for these vaccines, that includes Pfizer, Moderna, there is reduced protection against the Delta variant. And that is why it's still recommended after you have completed your second dose. Okay, don't get your selfie that you have your 2 doses, you completed it. It takes 14 days before antibodies actually are produced after completing the second dose and 1 dose for Johnson, for example, and that we still have to wear our mask because it takes some time for the correct antibodies to be produced. What is actually produced is the IgG, especially if a reinfection occurs in the lungs. Okay, so the IgG antibodies are already produced by the vaccines, but it doesn't produce the IgA. These are the antibodies that protect our membranes. That's why our throat, our nose, our nasopharynx are still okay locations where the virus can attach, and so therefore still have to wear our mask until the appropriate or antibodies are actually produced. Glenn, I saw Past President Jackie raising his hands, and I don't know if he wants to give a comment or a question. Jackie,
Okay.
you are
President
recognized.
Jackie.
Hi, Eric. It's so nice to see you again. I miss your company. No, I was going to ask you about ivermectin, and
Okay.
it was asked, and you very intelligently and properly answered the question. And so I withdraw my question. I'm satisfied with the answer. But congratulations on the service you're doing to Rotary and to the Philippines health system in general. Thank you very much, Eric.
Thank you. Thank you so much.
Right. Thank you, Jackie. I think we need read last one question. This is from LCP Ronnie Gonzalez. Okay, what is the DOH plan about the Lambda variant? If you have mentioned that our present vaccines is not effective for this kind of variant.
It's still the same, and it's on watch by the WHO. It's still a variant of interest. The thing with the lambda, it's not easily transmissible, but we don't know how it behaves in the Philippine population. So we just have to watch for it, and we hope that as we get more information, just as I told you earlier, the information I have now may be old information a few hours from now. Many of things I have said may be wrong. Maybe in a few hours, ivermectin is approved. We don't know. And things change. The data is so dynamic, and we are actually looking closely every hour for new information that we can share immediately as we can. Thank you, Glenn.
All right. Thank you, Dr. Eric Tayag. Okay, before we end this webinar session, okay, so let me present this. Okay. So from RC Club of Manila Supreme 198 presents this certificate of appreciation to Dr. Enrique Tayag for sharing his expertise on health and COVID response shared with the participants of this webinar entitled COVID-19 Updates for Rotarians, given this 15th day of August 2021, held via Zoom conference, signed by Charter President AKS Bincarion and Life-Changing President Madalay.
Thank you so much. I am honored and so pleased with everyone in this special webinar today. Your questions provide us an insight with here, not only in Rotary, but also in the Department of Health, how we can serve you better. Earlier, Glenn had a chat question wherein there was, or a suggestion that the district should be very cautious about events that will be actually happening or will be conducted by the district alone or with the Rotary clubs. I assure you that Director Gen, uh, our Robert Kowa, okay, our governor, our district governor, okay,
Okay.
has his team looking at this, and it is exactly why we have this webinar. We will not put anyone in an unsafe place or unsafe setting. And how do we do that? It's understanding the situation. It's getting to know our enemy, that's the virus. And that's why if you have suggestions, recommendations, please bring it up, okay? We have these area meetings. And District Governor Robert Kowa actually established this special committee for COVID-19, and which I lead now for our district. And I hope that we can help you, not only for the information that you need, but also for medical assistance and even vaccine assistance. Please contact us so that we can provide you the necessary assistance. Maybe sometimes we are not successful, but at least we tried, and we won't know how to help you if you don't inform us. Thank you,
Okay.
Glenn.
All right. So may paano tayo dito? May we call on our district governor Robert Coa? Just raise your hand.
Okay. I just want to inform everyone that this will not be our last seminar on this. As we go on, if there is any new information that Dr. Eric can share with us, we will definitely do more seminars, webinars on this, so that we could reach out and inform everyone in our district what's the real situation. Because of the so many information that we are drowning in and so many fake news out there, we need to be sure that what we are getting is the correct news. That's why we have Dr. Tayag here, who is doing this webinar for us. And as soon as I get informed by Dr. Tayag that he has any new information, we will continuously do this kind of webinars, even so that all our members, all the Rotarians in our district will be better informed, because being an informed Rotarian will be much will do our district and the community much help. For us who are helping our less fortunate, we must also stay healthy to be able to do our part in our society. Thank you. Thank you very much again, Dr. Tayag. And I appreciate you coming out even on a Sunday. I know it's a rest day for everyone, but because this information is so important that we cannot delay. Thank you again.
Right. Thank you, Governor, for that. So, before we end this, may we call on our life-changing President Madela for some messages.
Okay. So good afternoon, everyone. I am so grateful that all of you are here, and of course, I would like to very much thank you, Dr. Eric Tayag, for giving us all the information. Alam ko po na maraming gustong magtanong because all of us gusto nating maging maliwanag sa ating lahat kung ano ba itong mga nangyayari na to. And I want to tell to everyone that we are so lucky that we have Dr. Tayag in our Rotary. So kay Gov Robert, thank you very much po because nandito po kayo, and then thank you rin po that willing din po kayo na i-diretso po natin ito for the other time for Dr. Tayag. So I choose Sunday because before I do this webinar, nagtanong po ako kay Doc Tayag kung ano po ang araw na pwede siya at oras. So because he's very busy, kaya po Saturday yung naisip niya na ibigay sa akin. So salamat po ako that all my LCPs na nandito and also yung mga officers nandito rin po. And this is a very, very important all of us. Marami po tayong katanungan and then I'm so happy that Dr. Tayag is very willing to send kung ano po yung information sa kanyang slide. Okay? So, ang gagawin po siguro namin ni President-elect Glenn, kukunin ko po yung mga emails, pagtutulungan po natin na mai-email yung presentation ni Dr. Eric. So, Doc Eric, thank you very much na ibibigay mo po sa amin yung iyong presentation so that meron din po kaming copy. Thank you.
Kaya, Madel, baka mas mabilis kung sa Viber group ninyo, pwede rin namang i-post doon para mabilis. Over.
Yes.
Alright. Okay po. So, lastly, ipaparaffle na natin. Ilang raffle ba yung gagawin natin for today, LCP?
Okay. HS?
Yes.
Are you there?
Yeah, I'm here. How many, we have 84 attendees?
We are
Yeah,
all
more than 80 yeah po.
More than 90.
Yes.
Oo. Siguro we should have 3.
3?
Kasi 90 na eh. Oo.
Okay.
Alright.
So, actually, also Dr. Eric Tayag, no? Meron kayong paparaffle. So, my lovely wife will share his screen for the Wheel of Names.
Lady Chris, thank you.
Okay.
Unahin muna yung sa akin.
Okay.
Special thermometer. Okay.
Okay, first yung special thermometer natin. So,
I hope wala kayong fever.
Wala po.
Siya nga pala, pag senior citizen, a single reading ng 37.8 ay fever na. Baka hinihintay niyo yung 38 ha. Oo.
Okay.
Tapos, kung 37.2 to 37.7, multiple readings yun, fever na rin yun. Okay.
Alright. Okay, so we already have a winner po for the thermometer from Dr. Eric Tayag. Mr.
Okay.
James Ong.
Okay. Kailangan ko lang ng address para pag-grab delivery ko. Thank you.
Okay, next for the coffee table book. We have 3 coffee table book to be raffled.
Glenn, hindi mo ba i-check muna kung nandito si James Ong?
Okay. James Ong?
Tama.
Oo, dapat magpakita muna.
Alright, okay. James Ong still here?
I'm here.
Yeah, still.
Congratulations.
Right.
Can you focus him? Can you focus James Ong?
Where is James Ong?
Okay. He's off cam, so I cannot pin.
Okay.
Ito, andyan siya, oh.
But he answered. Okay, next.
Congrats, James. Congrats, James.
Thank you.
Okay, our fellow member and the director, Melinda Go. Still here? Yeah, she's still here.
Okay, Melinda, you can choose from any of my books.
All
I will give
right.
you a list.
Thank you.
Love ko yan. Love ko yan. Si Melinda,
Okay.
Director Melinda.
You have to raffle 2 more. Okay, it's Mario Dionisio Jr. Here, Mario.
Yes,
Yeah.
I'm here. Thank you.
Yes.
Thank you very much.
Can come, mate.
Yes, I'm here.
Congratulations, Mario.
All
I will
right.
get a copy of my collectible coffee table book.
Congratulations, Sir Mario Dionisio Jr. Next,
Papadala na lang sa iyo ni
Yes.
LCP Madel.
last coffee table book for today.
Ang ganda niyan. I love the book. Congratulations.
Congratulations to Andy Alcantara.
Wow, congratulations.
Yeah.
Great, congrats.
Congrats, Andy.
Thank you.
All right.
My honor that you all won. Wow.
Yan.
Si ASP ni Risa, syempre love ko yan. Si ASP ni Risa ng Rotary,
Alright.
Chinatown Circle.
Congratulations po sa mga winners sa raffle natin. Okay, so may we call on our LCP Madelay for the adjournment.
Okay, once again, maraming pong salamat sa lahat and happy Sunday. And I hope na tayo po ay naliwanagan at may mga susunod pa po ito. So, by the power vested in me by the Rotary International and as the life-changing president of the Rotary Club of Manila Supreme 198, I have the great honor and privilege to adjourn this most successful webinar. Thank you, everybody.
Clap, clap, clap!
Salamat po, mga mates.
Thank you.
Congratulations.
Congratulations, Madel.
So proud of our club.
Congratulations, congratulations, everybody.
Hello, PR Chair, Larry Colin. Hello.
Thanks, everyone.
Hi, AKS Bing. Congratulations, everyone.
Thank you so much. Thank you so much, Larry.
Thank you. Miss you. See you soon. Stay safe.
Yeah, see you soon, of course.
Congratulations, everyone.
Thank you, God. Thank you. God, thank you.
Thank you po sa lahat ng nag-attend. Thank you, Sir DS Edwin Chu.
Congrats, congrats.
Lina, ang ganda ng welcome mo.
Thank you, go.
Thank you,
Thank you.
Go.